Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony.
The only change that you have to the guidelines for persons traveling to Guyana is that we also now require them to have been vaccinated. And vaccinated mean at least they should have one dose of their vaccine. So we're not saying fully vaccinated, but we're saying vaccinated, meaning to have at least one dose of your vaccine. So that's basically the change that has been made. So anybody coming into the country now, as of Sunday, as of the 8th, you would now be required, apart from your PCR test, negative PCR test, to at least be vaccinated. It remains basically the same, that you will have to get a negative PCR. But in terms of persons who are 18 years and lower, we wouldn't require vaccination. We are only looking at persons 18 years and above. They would need their vaccination.
Okay.
At some point in the future, when we start doing vaccination for children, and once we have started that program here in Guyana, then at some point then we'll probably look at asking for vaccination for children. But as of now, that's not a requirement. So in addition to those that are approved by WHO, which includes Pfizer, Moderna, the J&J vaccine, AstraZeneca, Sinopharm, we have also approved the Sputnik V, because we have used that in our program. So basically those are the vaccines that we have approved.
Mm-hmm.
Now, having said that, and having those vaccines being gazetted in the order, we know, depending on where a traveler might be coming from, that there might be other vaccines that they might have used. So persons traveling in from India, for example, might use Covaxin, which has not really received its WHO approval as yet, but it's pending approval. Persons traveling, let's say, from Cuba might have received one of the vaccines developed in Cuba. So once we know, we will treat those on a case-by-case basis. But that traveler would have to inform us ahead of time so that those arrangements can be properly put in place. Going out, it just depends on what would be the receiving country's requirements. Some country, they allow for antigen.
Mm-hmm.
Some others require PCR. Others require PCR plus being fully vaccinated. So for those persons who are going out, you'll have to check the destination where you're going, what are the requirements there, and you'll have to fulfill those requirements. For some persons who are traveling long distances that require in transit, staying sometimes in transit at the airport, there might be other requirements, so you need to familiarize yourself with those things and make sure that you're in compliance. Based on the new orders, if you are not vaccinated and you're unable to present your negative PCR, you would not be allowed on the plane. So as of yesterday, for first dose, we had 267,000 persons, 267,150 persons who received their first dose of the vaccine. That would be approximately 54.9% of our population. And for second dose vaccination, we've had 144,324 persons who would have received their second dose vaccine. That's approximately 29.6% of our population. No, that's not going to help. We do know that COVID-19, if you're not wearing a mask, then and you're exposed to someone with COVID-19, that you can actually breathe in the viral particles. And while initially the viral particles might attach to the ACE2 receptors in your mucous membrane in your nose, it eventually works its way down to the lungs and you'll get infected. So that's not a very effective way of preventing anything. If you want to prevent COVID-19, then what you need to do is to have an effective mask. An N95 mask would probably be the best. In the absence of that, probably to use a surgical or procedural mask. And if you don't have any of those, to make sure at least you have a cloth mask, which would act as a physical barrier. If you're not wearing a mask, then certainly you would then be able, you would probably breathe in the viral particle unimpeded, and your chances are that you'll get infected with COVID. Okay. So for those persons who are vaccinated, the CDC has recently put out new guidelines that if you're in indoor environments, that you should make sure that you still wear your mask, because the Delta variant is very, very contagious, and masking plus vaccination would help to protect you. So again, coming back to your original question, I don't think saline in your nose would help very much.
Okay, thank you very much for that, Minister, and thank you for your time today. This has been our COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.